Greenings, Green Warrior, and welcome, Dr. Fuhrman.
Hi.
I'm
How
so
is, how
glad
is
that you're
everybody here? Good to see you.
I'm so glad that you're here. Green Warrior, are you hearing confounding messages about things like DHA, olive oil, supplements? Oh my. Dr. Fuhrman is going to clear up any confusion with good old science. And he'll also be taking your questions at the end of the broadcast. So, what we're going to do now is we're going to begin with our true or false questions.
It's time for True or False on Be Green with Amy Live. Answer true or false to Amy's questions in the comments below, and Amy will ask our guest for the expert answer.
All right. Well, let's start off with our common misconceptions and also the confounding messages that we're getting, even in the plant based world. True or false? All oils, including olive oil, should be eliminated from the diet. What do you think, Green Warriors? And while they're typing in their answers, Dr. Fuhrman, tell us about that.
Well, yes, I would prefer all oils be eliminated from the diet under the expectation that people are still going to get adequate fat from eating some nuts and seeds and avocado in their diet. Then they don't need the oil. And nuts and seeds and avocado are a healthier source of fat than oils would be. So yes, it's better to eliminate all oils from the diet and get our fats from eating whole foods like nuts and seeds. That's preferential. That's more beneficial. But olive oil would be a better choice than eating butter or animal fats, for example. So if a person is, but still, the American diet gets its fat from oils and animal fats. And a nutritarian gets their fats from nuts and seeds and avocado, not from oils and animal fats. You get a huge lifespan pump up from getting your fats from whole foods. So it is true they should be eliminated.
Well, very good. I'm glad you set that record straight for everyone. There's a lot of people promoting healthy fats, healthy oils, and it's just not true.
Yeah, it doesn't mean all fat should be eliminated. We're still getting adequate fat, but we're eating the walnut, not the walnut oil. We're eating the sesame seed, not the sesame seed oil. Is a big difference. Because as we put oil in the diet, in place of the whole food, the sesame seed in place of the sesame seed oil, the nut instead of, right? We're adding protein with the fat. We're adding other nutrients with the fat. We're adding anti-cancer sterols and stanols with the fat. We're getting fat that goes into our bloodstream at 1 calorie a minute, slowly, 1 or 2 calories a minute, not 40 or 60 calories a minute. So we get the oil gives us a caloric rush, a huge amount of fat enters the bloodstream all at one time, which has to be stored as fat. The body can't burn fat that quickly. So we're increasing the fat storage on our body by putting oils on the food. And we're decreasing the protein content of a plant-based diet. So instead of using nuts for the fat, we just took out 10 grams of protein out of the diet by using the oil for those calories instead of using the nuts or the seeds. So we lowered the protein and we turned on more fat storage hormones, which makes it more difficult to lose weight. Nuts and seeds make it much easier to lose weight. And believe it or not, when nuts or seeds are utilized for an equal amount of carbohydrate, we're talking about 2 isocaloric diets, 2 diets with the same amount of calories. So we take out some carbohydrate, like potato, like whole wheat bread, potato, or rice, and we put in 200 calories of nuts and seeds. We get more weight loss from including the nuts and seeds compared to using those same calories from carbohydrates. So we get more weight loss, not weight gain. But if our caloric need, our caloric window is, let's say 1,500, and we snack on nuts and we overeat them, then then it would not be beneficial. But if we're using it, substituting for another source of calories, not going over our caloric needs, it's actually more lifespan enhancing, more protective against cardiovascular death and cardiac arrhythmia, and more protection against cancer when you eat the right amount of calories and still have your caloric window be able to include the nuts and seeds as part of your caloric intake.
Well, very good. That really gave a wonderful explanation to our Green Warriors. And a lot of them are guessing the right answer, so I'm really pleased to see that as well.
Okay, good. This is fun.
Okay, true or false? A plant-based diet must include large amounts of legumes every day. Green Warriors, what do you think? Dr. Fuhrman, tell us about that.
I don't know whether to answer that true or false because I don't know what a large amount means. You know, I do recommend people eat legumes every day because they're so beneficial to our longevity. There's such the inositol pentachus phosphate alone activates the immune system to be able to kill cancer cells and the sterile. There's so many benefits from eating beans. So we're talking about these high protein plant foods, meaning green vegetables, beans, and nuts and seeds, and that combination gives a great protein punch. And beans are linked to enhanced longevity and lower rates of cancer. So I recommend a plant-based diet to include legumes every day. True, but I don't know if large amounts means. We should include an adequate amount, like half a cup to a cup. But you don't have to eat. You don't have to eat large amounts of any one food. We should be eating reasonable amounts of food. Not large amounts of food. So I'm not sure what the answer to that question should be because of the word large in there. A plant-based diet should include legumes every day. True.
Okay. Well, that's good. And a half a cup to a cup, would that depend on the body size?
That's
or
a
the
half a cup
activity
to
level?
a cup because I'm dealing with overweight people, because I'm taking care of people who are overweight. So I have their, nuts and seeds between 1.5 ounces and 2 ounces. I have their beans between a half a cup and a cup. I'm so much dealing with all the people I see every day are people who need to lose weight. But a person, who's physically fit, doing more exercise, slim, doesn't have to be in that window. They could have 3 to 6 ounces of nuts, or they could have 1 or 2 or 3 cups of beans a day. I mean, so it's dependent on your caloric needs. Just imagine like LeBron James, or somebody who's 6'8", an athlete might have to eat more food to meet their needs. So it's all adjusted to your individual needs, of course. But minimum of a half a cup a day for everybody. Even if you can't digest beans well, they should be having a little bit with each meal so the body can learn how to digest them better over time till they can move up the dose to like a half a cup a day. So we want them at least up to a half a cup a day of beans as a minimum, even if you're overweight.
Okay. Well, let's talk more about wanting to lose weight or gain weight. True or false, snacking and dried fruit are only for people who want to gain weight. All right, there's a lot of confounding information about snacking, people thinking that they have to eat a lot of meals throughout the day. So as they're typing in their answer, tell us, Dr. Fuhrman.
I don't know what the answer should this be. I do not recommend 3 meals and a snack, unless you're a professional laborer, a physical laborer, or a professional athlete. I recommend that 3 meals is enough for anybody, for most people, not anybody. 3 meals is enough for most people, the vast majority of people. And a lot of women do better with 2 meals and a snack, or some people do better with 2 meals a day. So it's either 2 meals and a snack, or 3 meals. But it's not 3 meals and a snack. You know what I mean? That's too much food for most people. You can get enough. You can certainly have 3 solid meals and get enough calories. Even me, I do a lot of exercise and I do fine with 3 meals. I don't need to snack. That's recreational eating or overeating. Unless I was when I was young, I was a professional athlete, then I probably could have had a snack. You know what I mean? So snacking and dried fruit, only people. And also we use some dried fruit for people who want to lose weight too, because let's say, for example, a person is eating a low caloric dinner, a 400 calorie dinner. They had their bean burger, their asparagus and Brussels sprout dish with a tomato sauce on top. And they had their raw vegetables with a dip, a little eggplant hummus dip. And so they were a low calorie dinner. And we had a dessert that had a half a date for 8 people. I mean, we put in 4 dates for 10 people. So little dried fruit to sweeten the little dessert we made for them. And that was okay because their caloric window was still in their caloric range. And the dessert marks the end of eating for the day. That's it. You're done for the day. You're not going to eat any more food. You stopped eating by 6 o'clock at night. So you have 4 hours with no food coming in before you go to bed at night. And the dessert helped them stop eating dinner before they got full. They finished their plate full of food. They have a little dessert. They never ate till fullness. They're in their favorable caloric window. And they know that means shut down the restaurant, the kitchen, shut down the kitchen, no more food the rest of the night. You had your little dessert, clean your teeth, recreate with other activities besides food for the rest of your evening, and stay out of the kitchen. And the only thing that passes your lips should be water, nothing with any calories in it. So in a sense, a little dessert with a little dried fruit, small amounts is still okay if their caloric window is otherwise favorable. And it could be helpful to have a person cut off eating, like a couple of prunes in a dessert was okay or something.
Okay. And I liked how you said, don't eat until you're full. Can you expound upon that?
If you ate till you were full, you overate. You shouldn't be stretching out your stomach till you're distended or full. That's habitually overeating and chronically overeating. It's not good for people. They should be eating till they're satisfied and stop eating before they get full. So I can eat a nice lunch of a bowl of soup, a nice big salad, and a couple of pieces of fruit. I'm not full. I'm just satisfied. How many people do you know have favorable body fats? They're all, they're very, very often, most people I meet, even when they're eating healthfully, they're still a little overweight, which means they're better off with a little lower body fat, which means work out in the gym, do some exercise every day, and watch your caloric window. Don't eat till you're full. Be a lean version of you, because the low body fat is the most powerful anti-aging thing you could do, is keeping your body fat favorable. Not except you don't want to be too thin like an anorexic, but we want to have good muscular tone and size and strength with low body fat. That's a sign of good health.
Yes. And there's a lot of confusion about that. Maybe we'll talk about that a little bit later too.
Right.
Okay. True or false? It is recommended to focus on low carb vegetables rather than a wide variety of vegetables, regardless of carbohydrate content. Okay, Green Warriors, that's a little confusing. Type in your guess, and Dr. Fuhrman, tell us about carbs.
I don't know the answer to this question either. You are stumping me with these questions because they're not like black and white.
Yes.
You know what I mean? It's
because
hard.
The reason why a lot of these questions are this way is because the people that are watching, they don't feel like things are in black and white. They feel like there's information all over a board, and they're confused because
it's not black and white. In other words, we focus on eating a wide variety of vegetables. That's true, but we also focus on eating a sufficient amount of green vegetables. And among the green vegetables, there's 4 categories of green vegetables we want people to eat, and they're low carb. So we are focusing on those low carb vegetables, but we're also eating a wide variety of vegetables too, but not to exceed our caloric window. Our caloric window is the calories that you need to maintain your optimal body weight. So the higher carbohydrate vegetables, corn, peas, sweet potato, even white potato, quinoa, all relatively healthy foods, but their amounts should be adjusted to your caloric needs. But beans are in a hierarchy of themselves. Those should be eaten. And if your caloric window is lower, then you don't have that much room for the other carbohydrates. Beans should be prioritized because they're so beneficial. And greens should be prioritized. So you have your lettuce and raw cruciferous, your raw green vegetable salad. And you should have also some cooked vegetables, both cruciferous and non-cruciferous, in your diet as well, like cooked string beans, asparagus, artichokes, zucchini, and also some cooked cruciferous like broccoli and bok choy and cabbage. So you have those 2 types of cooked, and you have at least 2 types of raw. So we want to focus on those because that green vegetable consumption is still the most accurate indicator of lifespan, because we're a green vegetable dependent animal. So we still want to have exposure to adequate green vegetables. And the cooked green vegetables are there because it enables people to eat more green vegetables than if they just had raw vegetables. So being a raw foodist, people usually don't eat as much greens as they do when they include some green vegetables cooked. They eat more greens. And the increased green in their diet enhances their longevity, the increased green. Some raw foodists are eating some salads, but they're eating so much fruit and avocado that they're not eating as much vegetables. So that's why it's good to include cooked mushrooms, cooked beans, and cooked greens. It increases both the protein, the assortment of nutrients, and the bioavailability of these lifespan enhancing and strength and bone mass and muscle mass enhancing nutrients as we age. So the answer, so here's the question again, let's go with it. Is it recommended to focus on low carb vegetables? Because greens are low carb vegetables. Yes, it's recommended to focus on low carb vegetables. Rather than a wide variety, now I should say, but also we should eat a wide variety of vegetables regardless of carbohydrate content. We should do both. We should focus on green vegetables, and we should be eating a wide variety. Eat carrots, eat beets, eat jicama, eat snow pea pods, eat peas in the pod, eat peas out of the pod, So yeah, we should eat other vegetables too, if we can, but we should really focus on getting enough green vegetables as well. Right.
Okay. Thank you very much.
Sure.
That was a little bit confusing, but that's because a lot of people are confused. So you really straighten us out. All
This
right.
is fun, though. This is fun. I have to admit, this is fun.
This is part of the format of my show because
Okay.
I like to engage our guests in fun in different ways. And I also like to engage the green warriors that are out there because it gets them to think about things too. And don't be afraid to put up an answer, even if it's one that may be right or wrong. Don't worry about it because that's what makes this fun
Are they posting their answers too?
Yeah, but if the answer is not correct, I don't put it up. So if it's correct, I put it up. Okay. So this way they're not apprehensive about putting up answers. Okay, so let's see. Here we go. True or false? A plant-based diet should be low in overall fat, even if the fats come from whole foods like avocados and nuts. Okay, there's the high-fat camp and the low-fat camp, and oh, so confusing. Dr. Fuhrman?
Well, again, I don't know if it's true or false. Let's go into this, but go into more detail. It depends. What do you mean by low in overall fat? I recommend people eat a minimum of 1.5 ounces of nuts a day, but I myself eat about 3 ounces of nuts a day, right? So, because I'm not looking to lose weight, I want to maintain, I have a lot of exercise. So that's not low in fat. So the plant-based diet that I recommend is generally between 15 and 25% of calories from fat. That's considered low fat compared to the American diet of 40% of calories and fat, but it's not considered low fat by these extreme low fat diets that people recommend not eating nuts and seeds or hardly having any, keeping their fat at below 10% or below 15%. I think 1 ounce of nuts and seeds a day is too low because the Seventh-day Adventist studies, that's keeping your fat intake below 15%. We want it to be above 15%. Those people advocating, especially for diabetics, keeping their fat that low, they're basing it on studies done on oil, not on studies done on nuts and seeds. So they're giving people incorrect and inaccurate information. There's no advantage for a diabetic reducing their nuts and seeds to only 1 ounce because of some studies show when you put oil in your diet, you increase some glycemic load or insulin resistance. The same, and body fat increases insulin resistance more than dietary fat does anyway. Overall lifespan is enhanced according to the studies on it, and especially the Seventh-day Adventist Health Study 2, show that the longest lived individuals were people who ate more than 1.3 ounces a day or averaged over 1.5 ounces a day. So that's where we picked that 1.5 ounces from, because that maximized lifespan. So I don't consider that diet to be low in fat. I consider it to be fat adequate. You have to take almost all the nuts and seeds out and avocado out of the diet. That's too low in fat. So let's go back to this question. A plant-based diet should be low in overall fat. Yeah, relatively low compared to the American diet, but not too low compared to those fat-phobic individuals telling you no nuts and seeds. It should be somewhere in the middle of that, somewhere between the American diet and these extremely low-fat people. You follow me? So it should be relatively low in fat, even if the fats come from nuts and seeds. And then again, you don't really have to limit nuts and seeds and avocado at all, really much. If I was a professional athlete and needed the calories, I'm only restricting them because as we get older, we're just exercising in like a half hour to an hour a day, and there's no reason arbitrarily where we have to concentrate on the fat content and be afraid of eating more nuts and seeds if your caloric window, if you needed a higher caloric window. So it's okay to go up a higher in fat if it's from nuts and seeds and you're adequately eating all the other foods you're supposed to be eating, beans and greens and vegetables and salad and fruits, and you're eating all the good foods you're supposed to be eating, and you want to eat a little more nuts and seeds and get your fat content higher because you're exercising in a physical job or you're working out, then go ahead. It's not going to hurt you to have a little higher in fat.
Right. But most Americans are sedentary or they're not very active. So exactly. that's what we have to keep in mind.
Exactly. That's why we're keeping it relatively low, below 2 ounces, because their caloric window has to stay below 1,500 calories a day because they're not very active. People don't need that many calories. They're just eating unlimited amounts. So the answer is true, but it should be relatively low in overall fat, relatively low, because we don't know what low means. It's not precise, right?
Okay, well, very good. That's very helpful. Green Warriors, true or false, organic produce is essential for a healthy plant-based diet. This is another thing that people are hearing different messages about. So as they type in their answers, what's your take on organic vegetables and produce?
Wow, I don't know. You're stumping me with all these questions. Wow, this is interesting. Because, I certainly prefer we all eat organic. We don't know all the risk factors from the pesticide residue. It's such an unknown bucket of information. Because the science shows that when people eat non-organic produce, they still have better outcomes than people eating no produce, and they still live longer. So should we go all the way to organic? I don't have so much definitive science to document that. We know that organic and better farmed and better naturally fertilized vegetables have more nutrients and more diversity of nutrients in them. We see better food grown in better soils because of better nutrients. And I'm such a health nut that I want to eat most of my diet organic and regenerative grown. So, but I don't know, use the word essential. I would say organic produce is preferred. Organic produce is preferred for a healthy plant-based diet because we don't know all them. We can't enumerate all the potential risks and the unknown negativity of all these pesticides we may be exposed to. So the answer is it's preferred. But I wouldn't use the word essential because we don't have enough data to know that with 100% certainty.
Well, that's a great way of answering it. I know that we have what is called the Clean 15 and the Dirty Dozen, that
Right.
people can look up those things. But I also have learned from different interviews that I've done that the plants that are grown organically, they have to come up with defenses against pests and diseases, and that the defenses that they come up with, that they create in themselves, also help us when we eat them. You want to talk a little bit about that?
Well, yeah, the better the soil, and this combination of better soil and natural organic farming leads to more nutrient-rich crops. Younger plants are even more nutrient-rich, and regenerative organic agriculture leads to where you're really not damaging the soil, and it's building good soil is even better. And then the other issue is obviously residual chemicals and pesticides in the dirt and on the food. And also you're killing bees and insects, and also the pesticides and herbicides used for conventional produce harms the farm workers and the laborers who work in the fields and increases their risk of lymphoma and soft tissue cancers. So by us eating organic, we're making it a healthier working environment for the people who pick our produce and farm it for us. So if you could afford it, then organic is certainly recommended for the planet, for the people working the planet, and for our own health too. But you still, so it depends on your definition of the words essential here. You know what I mean? It's still better to eat non-organic than it is to eat the fast food, because it's the junk food and fast food and processed foods most Americans eat, they're even more full of junk and pesticides and plastics than even the inorganic produce is. So it's all relative. It's still a step in the right direction to go all the way to regenerative organic agriculture.
All right. Well, I guess good, better, best, and that's very helpful.
Yeah, exactly. Good, better, best. That's good.
Yeah. All right. Green Warriors, true or false? Frequent small meals throughout the day are better than fewer larger meals. Oh, my goodness. So many people are confused about this. So we have people that think that you are told that you have to eat every 2 or 3 hours throughout the day. And some people talk about an OMAD diet, 1 meal a day. So tell us, Dr. Fuhrman.
When you're a food addict and your body is toxic, then when your digestive tract gets empty, you get withdrawal from your poor diet. Like a person cut out cigarettes, they start to feel itchy and agitated, and they need that nicotine hit. And a person eating an unhealthy diet needs to keep hitting themselves with food because they feel wiped out if they go into the non-feeding state where detoxification is enhanced. So these people feeding people and advocating standard American diet styles encourage people to eat frequently during the day so people don't feel like these sugar drops are going down, like the blood sugar is dipping. You only feel that when you're unhealthy. When you're healthy, you're fine. You feel best when you feel great when your blood sugar is low. It's not too low. That's the catabolic phase of the digestive cycle when you're burning off glycogen and your body's in a healing and detox mode. So if you need frequent small meals for the day, it means your diet is unfavorable. If your diet is favorable, you won't need to eat as frequently. And the most important thing is not to eat after 6 o'clock at night and not to eat 4 hours within bedtime. I don't think it's so critical whether you had 2, 3 feedings or 3 feedings or 4 feedings between 8 in the morning and 5 at night. I do think it's critical not to eat again after 5 to get that big non-eating window between 6 o'clock at night and 7 or 8 o'clock when you eat breakfast, to get so you're sleeping with not digesting, because most anti-aging activity occurs in the sleeping state when you're not digesting food. And if you eat too much at night and too big of, even if you eat the right time, even if you have your last meal at 5 o'clock, but you make it too big of a meal, you could still feel yourself digesting 10 o'clock at night. So your meal should not only be early in the evening, but it should be the right size meal so you don't overeat to make digestion take longer to occur, take too long to occur. So the answer to this question, frequent small meals for the day are better? No, that's not true. Than fewer larger meals. It's better not to overeat. And it's better probably to go with 2 meals and a snack, 3 meals, but 3 meals and a snack is too much food. And usually the snack represents recreational eating, which means eating when you're not hungry, eating when you don't need the calories. And those are additional calories your body did not need to have. So and studies show that people who eat frequent small meals wind up eating extra calories at the end of the day compared to people eating 2 or 3 meals a day. They wind up eating more calories, which is not favorable.
Well, very good. I'm glad that you talked about that. And for those of you that haven't watched the show often, I am a nutritarian, and the before or after pictures that you saw in the beginning of the broadcast, that's me back in 2012 when I first came across Dr. Fuhrman on PBS. And
Wow.
then I just kept going back to the TV saying, what is this? I never heard this before. And I wanted to also tell you, Dr. Fuhrman, that my husband kept saying, because you had 3 segments, and he said, well, why don't you just go and buy it and donate to the station? You like the station, just get all the material and learn it. And you know what I said to him, Dr. Fuhrman? I said, okay, then what? Because if I learn it, I can't unlearn it, and then we'll have to do something about it. And
Right.
fortunately, he was willing to give it a try, and it definitely has helped us, and we're still going strong after, since 2012, so over a decade. But
Wow.
anyway, I just wanted
Cool.
to kind of put that in.
So cool. I'm so proud of you. It's so I'm so personally rewarded and blessed to have affected so many people in a positive way. I'm so lucky to have that opportunity to do that,
Yeah, and it's the science that you present that is so compelling, and that's what we really need to pay attention to, not what people are saying is a fad. It's the science. That's the only way that we can
There's so
actually get
much
results.
confusing and wrong information on the internet because the internet is a marketing tool. People are marketing all types of beliefs and all types of, so it's hard to be able to go through the weeds and pick out the pearls, it's hard for people.
Okay, true or false? The BMI, body mass index, is the best measurement of healthy weight. Okay, Green Warriors. What do you think? Dr. Fuhrman, tell us about BMI.
It's not a bad indicator. It's not the best, but it's not bad. It's not terrifically accurate because sometimes people are naturally bigger muscles and bones, and their BMI could be elevated because they're very athletically built or very athletes who are stronger and still could have low body fat. So it's probably body fat percent is still a better measurement than BMI. But BMI is still an important indicator not to ignore, because even when people are overly muscled, it's still not good if they're too big. It means they ate a diet that was too rich to get that large. For example, in the NOSH study, they found that the shortest lifespan of any profession in North America were linebackers on football teams, who weren't necessarily fat people, but they were people who weighed more than 250 pounds. You got to figure out what diet they had to eat to weigh that much and to be that big. They had to eat lots of meat and lots of food to get so large, but it still shortened their lifespan by eating to get that large, even though they were not really fat or didn't have high body fats and classified as obese. So the BMI is a measurement of healthy weight, and you can be careful not to get your BMI too high, even if it is muscle, to get too large, because you're not going to get that large eating a healthy plant-based diet. You're not going to get to be 250 pounds, no matter what you do in the weight room, unless they're eating protein powders and, whatever. But the point I'm making, you still got to watch the fact that what did people eat to have to get that large? And so BMI is probably not the best measurement, so it's probably false. It's probably body fat is a better measurement, but it still is an indicator we should look at that plays some role in the helping people to guide them to the most favorable weight.
Okay, so when we talk about weight, there are guidelines that our primary care physicians use. And what do you think about those guidelines that they use in determining whether or not their patients are at healthy weight?
They're too liberally permissive for people to be overweight. The conventional guidelines consider a person's weight normal with a BMI below 25, which is ridiculous, because all long-lived societies and individuals have BMIs below 23 or even below 22. The maximum lifespan BMIs for a male are between 19 and 22, and for a female between 18 and 21. So allowing 25 to be the cutoff line between overweight is a little bit excessively permissive. So I'm saying that even if you're on the scale of where you have a higher BMI because you're more muscular, your BMI still shouldn't be much above 23. It's still, occasionally there's always the rare example, but most people that's sufficient. But in any case, yes, I'm saying that long-lived societies have lower BMIs and that you're still a little overweight, even if you're in the upper range of normal on these standard measurements. You still can be overweight, even with a so-called favorable BMI of 23, 24. You may still have too much body fat and still not be an ideal weight for you.
Yeah. And that it does make it very, very difficult when they're putting people on medications and things are looking normal when they're on medications and they're saying that everything's okay, that their BMI is good and their different levels are good, but not necessarily so. Okay, here's one. True or false, fermented foods are necessary for gut health? Okay, Green Warriors, what do you think about that? Dr. Fuhrman?
It's false. Fermented foods are helpful when your diet is not favorable. But once your diet is optimal, the beneficial bacteria and the beneficial fermentation occurs in your digestive tract, and you don't have to eat fermented foods. So it's not necessary when you're eating a good diversity of natural foods and fibers. You don't need to eat fermented foods for gut health. You're taking in all the prebiotics, you're having the salad, the cruciferous, the raw, the beans, the mushrooms, the onions, all these things. You have an excellent microbiome with a very healthy biofilm, and there's nothing probably additional you're going to be benefiting yourself with fermented foods. The problem with fermented foods is that a lot of fermented foods are heavy in salt. And salt intake could be a major factor shortening people's lifespan or increasing the risk of hemorrhagic stroke. And in Asian countries, where they eat a lot of salt and a lot of fermented foods, they have the highest rates of hemorrhagic stroke and stomach cancer in the world, because high salt diets and fermented foods give you obviously a huge salt exposure, and those type of strokes are exacerbated by low cholesterol. Let me say that one more time. That when you have atherosclerosis, the thickened wall of the blood vessels, because of your high cholesterol intake or high saturated fat intake or high meat intake, building up atherosclerosis, increasing the risk of embolic stroke and heart attack could lower the risk of hemorrhagic stroke when people on an extremely high salt diet, like in Asian countries. People with higher cholesterol in Asian countries have lower risk of stroke because the strokes there are predominantly hemorrhagic stroke from all the salt. And the thickened walls of the blood vessels from high cholesterol could offer some protection, perhaps, against the hemorrhaging stroke when you have a lot of salt in your diet. The point I'm making right now is that being on a plant-based diet does not protect you against a hemorrhagic stroke should your diet be too high in salt. So we still have to watch our salt intake, and we can't think that I'm going to be fine if I eat really healthy. I can eat salt now because I'm still not going to have a stroke. No, you could have a hemorrhagic stroke, and those hemorrhagic strokes could be devastating. And those are the major strokes in Asian countries where they eat a lot of salt. And it could be the possible cause of death of some people who die prematurely and eat otherwise eating a healthy diet.
Right. So even if someone has what would be considered a normal blood pressure, that doesn't give them a permission slip to imbibe upon a large amount of salt intake a day.
That's correct. That's absolutely correct. Because every person that develops high blood pressure, not every person, but most people always say, oh, my blood pressure was always low my whole life. This is the first time I'm getting it high. Eventually, all these people who have low blood pressure eventually get high blood pressure from their salt intake. So should they wait to get lung cancer to stop smoking? Should they wait to cut out the salt till the blood pressure gets high, the end pathology of the blood, of the sympathetic tone in the nervous system changing over to high blood pressure? No, take away the salt while your blood pressure is favorable or low. Then you won't have it flip to become, how many people over the age of 70 or 75 are not on blood pressure medications that are still salting their food? I mean, they're all going to run into problems. But when we look at primitive societies, like the Kamamumu Indians of the Amazon tribes, who don't salt their food because they're separated, living outside of civilization, we see the same low blood pressure in the elderly as we see in their toddlers. We see very low, we don't see blood pressure rise with aging, and we don't see any heart attacks in those communities that don't salt their food, or strokes.
Yeah, and that's really important to hear, because I coach people, and I often have clients that right now have normal blood pressure, and they want to have added
I
salt.
think it's okay for them to have salt. I know it's crazy.
Yeah, and we need to also clarify that, and because this is something else that a lot of people get confused about. They think that added salt means that they take this salt shaker and they're adding salt to their food. And so many people that I encounter say, well, I don't salt my food, but yet they're getting a lot of
Well, they're
salt.
eating processed foods in bags and boxes and jars. I'm saying, don't learn how to eat foods. Don't learn how to read labels. Don't eat foods that have labels. But in any case, most foods with labels have salt, show you the sodium content, and you can tell whether the food, and you can read the label and see if any salt was added to that food or not before you eat it. And then there are a bunch of people that think that, Celtic salt and Himalayan salt and salt from the back of the moon or from the rings of Jupiter or from the rock of Gibraltar have some magical properties that suddenly make sodium in high levels no longer harmful. They're just, ridiculously belief systems based on silly marketing, as if these salts with trace amounts of minerals some way make the sodium less harmful, which is not true.
Okay, well, very good. Thank you for that. Green Warriors, true or false? A plant-based diet must include sea vegetables for adequate iodine intake. Okay, you're typing in their guesses, Dr. Fuhrman.
I don't know. The answer, because I recommend people take my multivitamin, which does not have folic acid in it. It doesn't have selenium in it, which doesn't have vitamin E, and it doesn't have vitamin A. It doesn't have beta carotene. There's certain things I don't want people supplementing with. So I make my own vitamin with a minimalist approach to have. And the answer, and yes, we have some iodine in that supplement that's designed from kelp, and kelp is a sea vegetable. Now, is that really necessary to put in that iodine from kelp? Well, if people are salting with salt, and they don't need that, but we're not salting our food, so maybe we need the iodine. Now, maybe we get enough iodine if we're eating some seaweed, but that's still a sea vegetable. So I'd say it's possible, but the way you assure you get sufficient iodine on a plant-based diet is either including some sea vegetables or having a supplement that has iodine in it that was derived from sea vegetables, because most of the iodine in these healthy food-based supplements are coming from kelp, right? So A plant-based diet must include sea vegetables with adequate iodine intake. I would say should include sea vegetables because the probability a person could be low in iodine is a risk we don't want to take.
Okay, so if somebody is including these sea vegetables, is it possible for them to have too much sea vegetables?
Yes, that's also a risk. The risk of having sea vegetables is that you can overdose because even kelp gives you the RDI for 1/10 of a teaspoon is 150 micrograms. So let's say you had half a teaspoon, that's 5/1/10 of a teaspoon. That's 5 times the recommended iodine intake, which can cause hypothyroidism. In other words, hypothyroidism can be caused by, hypo means low. So low thyroid function be caused by too little iodine and by too much iodine. By too much, it could suppress the thyroid. So a person could be putting too much sea vegetable or too much kelp into their food to give it like a flavor, like a Caesar salad flavor or like a seafood flavor to it. And they could have too much iodine. So yes, both too little and too much iodine is not beneficial. But you know what? Too little, much vitamin D is bad, and too much could be vitamin bad. Too much omega-3 fatty acids is bad, and too much could be bad. We want to hit the sweets for most of these supplements, or most of these nutrients we need. We want to hit that sweet spot in the middle and not take too little, which could be bad, not be deficient, or not have excess, which could also be harmful. So yeah, we got to be careful with both, having sufficient but not excess.
Okay, so if anybody's making that plant-based sushi, it's okay to have it, but don't eat it every day because maybe you might get too much iodine if you have a lot of it.
Yeah, but some of those sea vegetables like nori rolls and that are used in sushi don't have too much, are not too high in iodine anyway. They still can use those.
Okay.
It's the kelp that you got to be concerned about. The kelp it can be very high in iodine.
Okay, very good. All right. True or false? Following a strict calorie limit is necessary for weight loss on a plant-based diet. Green Warriors, what do you think? Dr. Fuhrman, tell us about that.
I would say it's generally false because when you're picking the right foods, it's easier to keep your caloric window favorable. And if you go a little over 100 pounds more or less, 100 calories up or down a little, it's not going to be unfavorable. So a strict caloric limit is not necessary for weight loss on a plant-based diet. So that makes it false because it's not necessary. But some people with a metabolic hindrance for weight loss, or some people who are like, let's say a small elderly female who's like 5 feet tall, who can't be that physically active, that she needs to watch her caloric limit because her caloric needs are so much lower than an active, bigger, larger, or more physically fit or active person. So it can be helpful for many people to know their caloric window or caloric limit, but it's not necessary for most people. We just eat, if we don't, especially if we're not eating till fullness and we're eating a well-balanced diet, our weight's going to gravitate towards the healthiest weight, especially if we're not recreational eating, but eating the right amount of meals, the right amount of food, not eating till fullness, and we're having good balance in our meals, and we know our own instinctual feelings for how much food we should eat. We don't need to count calories or limit calories. We just eat what we feel like eating with the expectation that what we feel like eating will be the right amount of food because we can trust our instincts when we eat a diet so healthfully.
Okay. True or false? Soy products like tofu and tempeh should be avoided entirely. Okay, Dr. Fuhrman?
That's definitely false because soy products have been shown in more than 1,000 studies to dramatically lower rate of breast cancer and prostate cancer, lower the rate of breast and prostate cancer, and enhance muscle mass and bone mass with aging and immune function with aging. So soy products are beneficial to us, particularly soybeans, both used in dried form, cooked in soups, and used in fresh form that are boiled like edamame. So they're both excellent foods. So we don't have to avoid these foods entirely. We should eat them regularly, but we should keep in mind that it's important to have a wide variety of different types of legumes or beans in our diet. And we shouldn't be eating so much soy that it limits the legume and bean diversity in our diet, because a lot of different types of beans have beneficial effects and enhance the longevity potential of the diet. We use a variety of beans. So if eating some soy, some azuki beans, some red kidney beans, some lentils, some chickpeas, some this bean, some that bean. It's better than just having a diet of all soy, but we shouldn't be avoiding soy, which should be part of our total bean intake.
Okay, thank you. All right. True or false? Fruit should be eaten in unlimited amounts, regardless of its sugar content. That's another thing that people are just so confused about fruit. Tell us, Dr. Fuhrman.
It's confusing too, because, some people recommend fruitarian diets or diets where they're mostly fruit too. And I've been doing this for, almost 40 years now, and I've seen so many people on different diets, particularly fruitarian and raw food diets, who have not done well in their later years and developed more immunosenescence or immune susceptibility to pneumonia or fungal infections. So the answer to the question is that it's better to pay attention to protein content as we age by minimizing fruit in our diet. So there are 5 natural plant foods there's fresh fruit, there's vegetables, there's beans, legumes, nuts and seeds, and intact whole grains. Out of those 5 categories, the only category low in protein is fruit. So if we go too high in fruit, that means we're taking out other calories that are higher in protein, and it lowers the protein concentration of our diet, which could lead to more immunosenescence and levels of IGF-1 that are too low in later life. From being a diet too high in fruit, because it means you're not eating enough of the higher protein plant foods and you're eating too much fruit in proportion to those other foods. It's the same when you put oil in your diet. When you pour oil in your diet, you're using fat that doesn't have protein in it. Where it's the same calories with nuts and seeds, you'd get 10 grams of protein or so. So in any case, yes, fruit, the amount of fruit we eat should be limited to assure that we get sufficient protein and we're eating enough vegetables and beans and nuts and seeds and even intact whole grains. So we don't eat a diet that's predominantly fruit. And that means a person could be eating 6 pieces of fruit a day or 3, that's fine. And I could be eating more fruit if I'm going on hikes and being actively playing tennis. I could eat more fruit than that because I'm taking adequate salad, taking adequate nuts, I'm taking adequate beans, taking adequate vegetables. But if your diet is mostly just fruit, then you could be overdue and not getting enough of the other things you need in your diet sufficiently. So fruit should be eaten in limited amounts so it's not the major source of calories in your diet. So that the only other foods combined, the other 4 foods, are giving you a bigger caloric load than the calories from your fruit load, to make sure you're getting adequate plant protein in your diet.
Okay, well, I have another one that's one of my favorite things that I've heard you talk about. True or false? Nutritionally, chicken is like a bagel.
Yes, I'm saying that that's true because chicken is like a bagel because neither one contains a significant micronutrient load of particularly the phytonutrients and the antioxidants that are present in colorful produce. So there are 3 types of food. There's produce, there's animal products, and there's processed food. And the processed foods and the animal products are similar in that they both don't have the phytochemicals and antioxidants and huge nutrient diversity that are in colorful plants. Also, they're hormonally unfavorable too. In other words, chicken, because of its animal protein concentration, raises IGF-1 to levels that are too high, that excessive levels of IGF-1 promote cancer, well established. And bagels, because they're white flour or sugar equivalent, they make for a glucose caloric rush, and they drive up insulin. And it's insulin being high and IGF-1 being high that give you the witch's cauldron of ingredients that create cancer. That's why, macaroni and cheese, hamburgers, pizza, hams, all these sandwiches Americans are eating that are high in white flour and sugar, because white flour is sugar, and high in animal products, give people the most dangerous diet that can be scientifically created to create the most degree of cancer deaths and stroke deaths and heart attack deaths in the world. And one of the most dangerous places to live in the world is southern parts of the United States, where they eat a lot of fried foods. And we see the most nutritionally derived premature deaths. So I could ask the question with how many people you know that had a cancer or a heart attack or a stroke in your family or in your neighbors or in your friends. And I'm saying, well, why do you want to live in that dangerous neighborhood? Everybody around you is getting these horrible diseases. Get out of that neighborhood. Means get out of those neighborhoods where people are eating those kind of foods. Start to eat foods that give your body the protection it needs, so you don't have to have what happens to other Americans happen to you.
All right, very good. Here's another thing that people are confused about. True or false, a cholesterol level of 200 is considered healthy and indicates a lower risk of heart disease.
Well, ideally, we want the LDL cholesterol. That's the bad cholesterol, is LDL. And that the really bad actor is oxidized LDL. So it's oxidized LDL. And don't forget, when you're eating a nutritarian diet with all these antioxidants, your oxidized LDL is going to be very low. So it's not the cholesterol level that matters that much. It's the LDL cholesterol that matters, because the cholesterol level is made up of both LH, good cholesterol, and bad cholesterol. And you could have a high level of good cholesterol, which makes the total cholesterol seem a little higher. But generally speaking, people are striving for a total cholesterol below 150 and an LDL below 100. So total below 150 is considered healthy, and a LDL below 100, that's generally what we're going for. But keep in mind that the dietary skeleton and the quality of your diet and your body weight is more important as a risk determinant of heart attacks than is your cholesterol level. So a cholesterol level is a minor determinant. Your dietary analysis of how healthy your diet is and your body weight and your blood pressure are more significant determinants of risk. So even though people focus on the cholesterol because they get treated with a statin, it's better if you let your cholesterol run higher and got your weight down and ate healthy. That would give you more protection, regardless if your cholesterol came down or not, which it will come down anyway. When you eat better, it comes down too. But besides, even if it's higher, you're still better off. You're still better protected with a healthy diet than you are with a statin drug.
Okay, so what's on your plate is a better indicator of
Correct.
your health.
That's correct.
All right, very
Because
good.
what's on your plate is reflective of the nutrient density of the cells in your body. And so now the nutrient density of the cells in the body, which determines my longevity and resistance against cancer and heart disease, is proportional to the nutrients I eat in my diet and my body fat level. Because the bigger my body fat level, the lower the nutrient density of each cell, because the same nutrients are now diluted into a bigger mass of tissue. So we keep our fat cells low, we keep our fat percent low, and we keep our nutrient density high, and we have a higher micronutrient concentration in our body's tissues, which is the secret to living a long, healthy life.
Okay. True or false, a low white blood cell count always indicates an underlying serious illness or infection.
Well, we know that us nutritarians have lower neutrophils and lower total white blood cell counts, which represents less inflammation and longer lifespan and lower rates of cancer. So I just did a study that was with like 6 or 8 other scientists that did the extensive blood work and longevity markers and inflammatory markers on 48 nutritarian women who've been eating this way for more than 5 years, comparing them to 48 standard American diet eating women. And we saw these lower inflammation, lower aging markers, biological aging, and lower white blood cell counts, lower neutrophils in healthy people. So what I'm saying is that it's normal to have your white blood cell count be outside of the normal range and be below the standard range on American blood tests on a nutritarian diet, because that low white blood cell counts indicates a heightened degree of excellent health, not a disease process. And healthy eaters should be aware of that having a white blood cell count of 2.6 or 3.2 when the normal range is 5 to 10 means that your level of 3.2 is better than a person with a higher level who's in the normal range. There's nothing wrong with yours. That should be there because you're eating so healthy.
Okay, very good. I think that we're going to start with some of the questions that have been coming in. So Victor Laviola said, if applicable, what volume of food should one eat in a day? And in what percentages in fats, carbs, and proteins? What should be the general caloric intake per day? Thanks in advance.
Yikes, I can't answer that because we're all in different sizes and we all have different metabolisms. We all have different exercise habits. So, one woman could be an elderly person who's overweight and who's relatively inactive could need 1,200 calories a day or even or less. And maybe a male that's highly physically active and 6'4" could require 3,500 calories a day or something. So I don't know what you should eat in one day. I mean, you've got to become the expert in you. So you've got to know what you should do based on you achieving your body weight, your best body weight. So here's what I'm saying. I'm saying a nutritarian is a person who's eating healthfully at their perfect body weight, or eating healthfully and moving in the direction of their perfect body weight by at least 1 kilogram a week or 2.2 pounds a week. If you're overweight and not losing 2 pounds a week, you're overeating or eating wrongly. So you're doing something wrong. You should reevaluate that. So what's the general caloric intake? I don't know. I know in, let's say, rural China, the average caloric intake of excuse me.
Bless you.
Thank you. The average caloric intake in more primitive populations are around 1,500 to 1,600 calories a day, and the average American eats 3,300 calories a day. Now, given the sedentary and the exercise habits of Americans, 3,300 calories a day is like way more calories than people need. That's why everybody's overweight. And I say half of what we eat meets our needs, and the other half meets the needs of our doctors. So our caloric window should probably be more compared to an individual needs, in the 1,200 to 2,500 range for most people. So around 1,500 for most women, around 1,800 for most men. So I'm saying that how much calories you really need more precisely is based on your individual, who you are, how much exercise you do, what your body fat is, how much food you eat, what quality of food you eat. And you could adjust that, right, to make sure you're losing weight by eating more salad, eating more cooked eggplant and mushrooms and artichokes and asparagus. And you can adjust the caloric density and the nutrient density and the quality of your diet accordingly to make sure you're the best version of yourself. So you've got to figure out the right answer for you. I don't know the precise answer for everybody. It's different for different people, right? So what volume should you eat in one day and what percentage of fat, what's the general caloric intake? I don't know. What's the percentage of fat, carb, and protein? There's no one right answer. We know that 80-10-10 is too low in fat. So we're recommending a minimum of 15% of calories from fat. And I found that the 80-10-10 leads to more osteoporosis and muscle wasting. And we found that in studies on European vegans where they were eating a lot of white flour and oils and more junk food, and they had more osteoporosis on a plant-based diet compared to a meat-based diet. When I compared the average starch-based or typical vegan diet compared to a nutritarian diet, which uses more beans and nuts, we found that we got more vitamin E and protein, and our protein amount was closer to 15 to 17%, not 10%, like more low-fat vegan diets. So like 15, 70, up to 20, 60 are more appropriate ratio of fat, carbohydrate, protein compared to, or 20, or it would be 15, let's say 60, 25, right? Yeah, 25 fat, 15 protein, 60 carbohydrate would be okay. 70, 15, 15 would be okay. Those would all be legitimate protein. But I'm not asking you to learn these percents or to focus on the percent or even know the percents. Because when you eat healthy, you're going to get adequate protein and adequate fat. You're going to be in that favorable window. So don't worry about it. Just eat a healthy diet. So I'm asking you not to worry about these things. Eat healthfully, don't eat till full, and make some adjustments up or down if your weight's not moving in the right direction to being the best version of yourself possible.
Very good. Rick Tano said, is it okay to use miso?
Only in small amounts if it's low salt miso. We still want to watch our salt intake, and some misos are higher in salt. So you can use it as a flavoring in small amounts, but I don't usually recommend people add more than 300 milligrams of extra sodium to their diet over and above what the natural foods are giving them. So make sure you're using this very small, because I know with me, I don't even want to eat 150 milligrams. If I have 300 milligrams of extra sodium, I don't feel well. I'm dry mouth at night, wanting to drink more, wake up drinking and urinating more at night. So it's even too much salt for me. So the answer is minimal amounts, and make sure you use the lower sodium version, just because you don't want to get too much salt. There's nothing wrong with miso. It's the salt content, right?
Yes, and a lot of them have quite high content of
Could have
sodium.
quite high salt content, right?
Oh yeah, it's really I've been looking around and I haven't really seen many that are low.
Mm.
Okay. Thanks, Ed. How do I get probiotics without eating yogurt?
Well, the question is, do you need to take probiotics if you're eating a healthy diet? And the answer is no. What do you need probiotics for if you're eating a wide variety of plant fibers and resistant starches? So a healthy diet, a person doesn't need probiotics or prebiotics. It's only people eating unhealthfully that are not getting a good variety of fibers and resistant starch that need probiotics. So you don't need probiotics. You don't need yogurt when you eat a healthy diet. And I call my diet a nutritarian diet because it represents the pinnacle of healthy diets with all the inclusion of all the right things people need, the beans, the nuts, the seeds, the onions, the scallions. We put all these healthy anti-cancer foods in it, and we call it a nutritarian diet to delineate a diet that's much healthier than a blue zone diet where they get 8 to 10 years of extended lifespan, just haphazardly eating some foods that are better than Americans eat. We're scientifically designing to include all those foods we know extend lifespan and prevent cancer in a nutritarian diet, and then learn what that is, follow that, and forget about the probiotics.
And pretty much the nutritarian diet is all prebiotics.
Lots of
That's what you're
prebiotic
eating.
substances in the diet already from the foods you're eating, correct?
Yeah, so that's what's giving you your healthy microbiome. And I often think of it as when you're fertilizing a garden, that all these nutrients that we're eating in the nutritarian diet, that's what our gut is getting fertilized from all those nutrients.
Absolutely.
Okay, let's see. Myra said if you're having a tablespoon of flaxseed and oatmeal and a tablespoon of walnuts in it, is it too much nut seeds to have a nut-based dressing you recommend on your salad at lunch?
No, that's the right amount. It's not too much because a tablespoon of it's about, I think 2 tablespoons of ground seeds give you a half an ounce. So the tablespoon of flaxseed, tablespoon of walnuts is about a half an ounce. That's the right amount for a person looking to lose weight. Probably not enough for me. I'd like a little more than that. And then the salad dressing is at least a half an ounce of nuts and seeds per serving. So you put 2 ounces of nuts in to make a dressing for 4 people or 4 servings, and you're still about half an ounce per meal. You have some left over to put with your dip or your sauce or your dessert at dinner. So that's not too much. That's the minimum amount you should eat for people looking to lose weight. I'd probably eat more than that,
Okay, Janet says, can I please ask how the consumption of cruciferous vegetables could negatively affect the thyroid?
It's almost impossible for that to happen unless you're eating large amounts of cruciferous juice each day, because you couldn't consume enough. And your diet would have to be very unbalanced because you would just be on only cruciferous vegetables to suppress the thyroid. If you're eating a variety of different foods and cruciferous vegetables are a part of the variety you're eating, you couldn't take in enough to suppress the thyroid. You'd have to be juicing pounds and pounds of the stuff to have thyroid, to show thyroid suppression. And you'd have to also be iodine deficient. So if you're not iodine deficient, eat as much cruciferous vegetables as you possibly can. You're not going to suppress your thyroid, unless you were juicing large amounts. Now, when we use juices for people with cancer or people with autoimmune conditions, we give them 1/3 carrot and beet, 1/3 lettuce, celery, and cucumber, and 1/3 cruciferous like bok choy and cabbage. So the 1/3 in the 9 or 10 ounce glass is only 3 ounces of juice of cruciferous twice a day. That's 6 ounces of cruciferous juice added to their diet. They're not going to suppress their thyroid. It's not enough cruciferous to suppress the thyroid. You've got to really overdose a huge amount to an unnatural, crazy amount of cruciferous to suppress the thyroid. So forget about it.
Okay, very good. Thank you for that. Rick Tannell said, is it, oh, no, I had another question from him. There you go. Tell us about mushrooms.
Well, mushrooms are the life of the party, right? They are, you know what they're saying. Mushrooms are superfoods, right? They are the superfoods that lower estrogen levels, reducing risk of prostate and breast cancer. That's called aromatase inhibition. They are angiogenesis inhibitors, which means they prevent blood vessels from growing to fuel fat or fuel cancer cell replication. They activate antigen binding lectins, meaning they stick to cell surfaces that are abnormal so the immune system can recognize them to kill cells that could eventually become dangerous or cancerous. They are the richest source of ergothioneine, which stabilize the DNA from aging in the cells. So mushrooms are just a super duper food,
Oh, I
And
love
they,
that. Okay. Did you have more that you wanted to say?
no, I just wanted to say that um, whether you have that mushrooms, they don't take up much room, but they're super healthy.
Okay.
I'm thinking of some stupid joke, but it didn't come out
Yeah,
too.
mushroom. That's what I was thinking, that you were making this joke.
I was making some stupid joke, but I missed the joke.
Well, I'm gonna keep that little blurb right there because I do include a lot of mushrooms in my, diet, and when I because I batch cook them, I buy a lot of them at a time, and, oftentimes, the clerk at the checkout will say, "What are you gonna do with all those mushrooms?" Because it's just quite a lot that I get so I can batch cook them. So now I can just say, "If you really wanna know, I'm gonna tell you why I eat them," and play that. Okay, Anna said 100% nutritarian for over a decade. No
Wow.
meds. Over past year, chronic brain fog, fatigue, headache after exertion. Brain scans all negative. PCP stumped and says I must have long COVID. Advice?
Um, well, I'd say check, because you're eating a healthy diet for a long time. So that's more suspicious for some environmental concern like mold or toxic poisons in your neighborhood or bad water or something, or drinking, something that you could still be taking in something toxic that's not dietary related, pesticides or where you're living. So let's, mold in the house. I would check your omega-3 index and do a more careful evaluation of your work environment or home environment and toxic exposure. And also, this could be caused by exposure to COVID vaccines and COVID, both, right? So it could be COVID but even long COVID, it'd be very almost impossible in 100 in nutritarian for over a decade, right? So the question is, let's see your omega-3 index. Make sure you're on the right supplements you need, and make sure you're taking your. That's important because you can result in brain shrinkage from having low omega-3. That should be supplemented accordingly. And I would be looking around your house for mold and stuff or something wrong in your environment if you're still feeling ill with eating so healthfully.
Okay. And I'm glad that you said that because oftentimes people adopt this whole food plant-based lifestyle and maybe they don't always see a resolution to some of their health issues. And there's more to it than just what we eat. You kind of alluded a little bit to it when you were talking about exercise. And of course, we have sleep, but then we also do have these environmental concerns.
Yes,
So,
environmental toxins. People could be exposed to something environmentally unfavorable that has to be concerned about, particularly in certain workplaces. Occupational exposure could be large.
yes, very good. Very good. And there's even household cleaning things that we have to be worried about as far as the products, the
Right.
laundry and
Some old buildings have high mold counts that people have to work in. You know what I mean?
mm, yeah, yeah. Okay, well, that's very good. Well, I'm just having such a great time. I could just play this true false with you and get all these comments with you for a long time because I always am very interested in what you have to say. And I've been following your work for quite a long time, Dr. Fuhrman. And I really want to thank you for your expertise and for clarifying so many important aspects of the plant based diet. And Dr. Fuhrman, what's your final take home message for our Green Warriors?
My final take-home message is that um, with nutritional excellence, it puts us in control of our health destiny. And it's not luck, and we don't have to live with fear. We can have more joy in our life, more security, and more peace by knowing taking care of our body in a rightly. And so, getting rid of food addictions and abusive and self-destructive eating behavior is tremendously rewarding experience for your life. It's not we're giving up; we're just gaining so much peace.
Very nice. Thank you. Green Warrior, tell us what you're going to remember from today's broadcast and type it in the comments so that people who are going to be watching later on can review the things that we've been talking about and what made us turn that light on and maybe learn something. I also wanted to thank Just Tess Voice. She did the promos, she did the countdown, she does the thumbnails. She's doing a lot of things in the background to get a lot of people out there, and they've been aware of our channel. But before I move on, I wanted to give Dr. Fuhrman opportunity to tell us about what he does and how we can find you.
Thank you. Well, at drfuhrman.com, which is drfuhrman.com, I give people lots of information, teachings, and products to make their life easier. But I have a member center where people can actually get my help and guidance in the Ask the Doctor forum, so people can actually communicate with me directly if they join at that membership level. And then I also have a retreat in San Diego called the Eat to Live Retreat, where people come and stay with me for a month or 2 or 3 to lose weight, get their health back, and recover their health under my guidance. So if people need my assistance, obviously, I get a lot of personal reward and satisfaction from working with people and helping them recover their health. So wishing you all the best. And if you need my assistance, you can reach me.
Well, that's great. And Dr. Fuhrman's going to be signing off with me in just a moment with my tagline. But while we're getting ready for that, Jess Tass Voice, tell us who's coming up next.
It's time for True.
There we go.
Do food cravings sabotage your healthy eating goals? Discover the strategies and insights that helped Esther Loveridge, who at age 72 lost 130 pounds. Conquer cravings and embrace a healthier lifestyle. Join us on Wednesday, July 7th, 3 p.m. Eastern, noon Pacific, on Be Green with Amy Live.
Well, most of all, I want to thank all of you, Green Warriors, for joining us today. Your engagement and support make these discussions meaningful and impactful. And I hope you feel inspired to take a closer look at your food choices and make some positive changes for your health and well-being. And remember, every bite we take is an opportunity to nourish our bodies and become the healthiest versions of ourselves. So please stay tuned for more empowering content, and please subscribe to my channel and share my message with others who can benefit. And also look at Dr. Fuhrman's social media, and he has quite a lot to offer on his website too. And he has a YouTube channel, Instagram, lots of places where you can find him. But together, Green Warriors, we can make a meaningful difference in the world. And as a special thank you, I'm offering you 5 free recipes. So just go to my website, begreenwithamy.com/join, and I'll send them to you. And also, we were talking about a lot of the different things that are important for health. And one of them is just spreading goodwill and love throughout the world. And I like to do that on this broadcast. So I'm inviting all of you to go ahead and take your right hand and grab your left shoulder and grab your right hand and squeeze. And that's a hug from me to you. And I'm so grateful for all of you for being here today. And if you'd like to join me with Dr. Fuhrman, and he's going to say the last word of my tagline, and you can type it in the comments. Are you ready, Dr. Fuhrman?
Sure.
All right. Well, until I see all of you again, remember, be strong, be well, and be
Green.
green.
All right, we're green.
Thank you, Dr. Fuhrman, so much. It's been such an honor to have you. Thank you, Green Warriors.
Thank you, Amy. That was lots of fun, and you made it really fun and interesting for people as well. I appreciate you.
Okay, and I appreciate you. Take care.
Looking for really tasty recipes that are SOS free? No sugar, oil, or salt. How can it taste good? Well, if you like flavor, then you'll love this Be Green with Amy recipe ebook. Get your copy today. Click on the link in the show notes. Be strong,